Hello, everyone. My name is Elijah Williams, and my presentation is on Staphylococcus aureus. This bacterium is one of the most common causes infections in humans and has a major public health importance. Again, as I said, my name is Elijah Williams, and I will be guiding you through this topic today. Staphylococcus aureus infection is caused by gram-positive bacterium that belongs to the family Staphylococcus. When cultured in the lab, it produces white, yellow, or golden colonies, which is where it gets its name, aureus meaning gold. Some strains are harmless, living on our skin or even in our nose, but other pathogenic and produce toxins that damage our tissues as well. These toxins can cause food poisoning, skin infections, and even severe systematic diseases. The description of agent is bacteria. This bacterium is in a round shape called cocci, and usually appears like a grape-like clusters underneath the microscope. It is non-motile, meaning it does not move on its own. It does not form spores. It survives in oxygen-rich and low oxygen environments, which makes it very adaptable. Its nature reservoir is humans, especially on the skin and nasal passages. Importantly, some strains have become resistant to antibiotics, creating a major public health challenge. Staphylococcus aureus spreads mainly through direct contact. This includes skin-to-skin contact with an infected wound or boil. It can spread indirectly through personal items like towels, razors, or clothing. Outbreaks often occur in hospitals, gym, daycares, and other crowded places. This is why good hygiene and cleaning are essential in preventing the spread of this infection. In the United States, there are around 119,000 bloodstream infections caused by staph each year. About 30% of people carry this infection on their skin or in their nose without symptoms. Even though many people are just carriers, this bacteria is linked to about 20,000 deaths each year in the US alone. These numbers show how common it is and how serious the outcomes could be. Signs of infection includes painful red bumps, swollen boils, and pus-filled abscesses. Symptoms may include fever, chills, fatigue, nausea, and a rapid heartbeat if infection spreads. The incubation period varies. It can be short as a few hours for food poison or several days for skin infections. Treatment usually involves antibiotics, but resistant strains require stronger drugs such as vancomycin. Abscesses may also need to be drained. In serious cases, surgery is required. Because of rising antibiotics resistance, treatment can be complicated. Population at risk. Certain groups are more vulnerable. This includes individuals with weakened immune systems, people living in chronic diseases, people living with chronic diseases like diabetes, kidney failure, in patients who are hospitalized or have medical devices like catheters. Athletes, because they are so in close contact, which makes them at high risk. As well, children in schools and daycares where germs can spread easily. Staphylococcus aureus affects people of all ages, but infants and the elderly are at the high risk of severe disease. Males attend to experience higher rates of bloodstream infections compared to females. Black and Hispanic populations are disproportionately affected, which is linked to social and healthcare disparities. In terms of family and genetics, staph bacteria can colonize entire households, living on this living on people's skin and household surfaces, which raise the risk of repeated infections. Genetic factors also may make some people more resistant and others more vulnerable. Mental health can also be affected too, as well coping with within infections often face stress and anxiety. While marital status is not directly linked, we know infections can affect entire households, including partners and caregivers. Low socioeconomic statuses increase risk through factors such as crowding housing, incarceration, and limited access to healthcare. Communities with lower income levels often experience more infections overall. Environmentally, staph can linger on household surfaces, pets, and shared equipment. It spreads easily between patients, family members, and animals. Prevention strategies that include cleaning surfaces and even addressing pet exposure can reduce reinfections. There are major disparities in who gets affected. African Americans have high rate of invasive staph infections that are 2 to 4 times higher than white Americans. These differences are strongly tied to social determinants of health in such as income, housing, and access to care. This shows that staph infection is not only a medical issue, but also a social justice issue. There are screening tests for this infection: nasal swab culture, PCR tests, blood culture, and wound culture. But currently, there are no approved vaccines for Staphylococcus aureus. But there is still research that is happening now to have a vaccine for this infection. One hypothesis is that people who carry Staphylococcus aureus without symptoms are important in community spread. These asymptomatic characters may not realize they have bacteria, but they can still pass it on. In a study, in a study called Prevalence and Risk Factors for Oral and Nasal Pharmacological Carriage of Staphylococcus aureus, study had studied college students, and they found carriers that were more likely to have pets have carriers were more likely to have pets, go to the gym, and share instruments. These everyday behaviors created opportunities for bacteria to spread. This research shows us that lifestyle and environment can play a big role in colonization and transmission. It also suggests that prevention efforts should focus not only on treating sick patients, but also educating communities about hygiene and clean shared equipment and being aware of these hidden risks. A second hypothesis hypothesis is that specific residence resistance genes make staph infections more severe. In a lab study that found strains with genes like MECA, BLAZE, and FNBA were able to form biofilms. A biofilm is a protective layer that bacteria build to shield themselves from antibiotics. This finding is important because biofilms make infections harder to treat and allow resistance to spread. The study confirmed that bacteria carrying these genes are not only harder to kill, but also more likely to cause illnesses. This demonstrates how genetic research is helping us understand why infections are mild while others become life-threatening. There are still big gaps in what we know. There is no vaccine to prevent staph infections. Few new antibiotics are being developed, and we still don't fully understand how harmless colonization turns into severe disease. We also don't have effective ways to manage carriers in the community. Infection control consists in places outside hospitals as well as gyms or prisons. To address these challenges, researchers recommend stronger antimicro antimicro bac- antimicrobial stewardship programs to reduce use of antibiotics. Hospitals should screen and treat high risk patients, especially those who are at risk for MRSA. Public spaces and healthcare practices need better hygiene and cleaning policies. Education campaigns should teach communities about proper wound care and prevention. Finally, we must expand healthcare access to racial and economic disparities. Researchers suggest focusing on future studies on vaccine development, exploring alternatives like bacteriophage therapy, studying genetic factors that influence resistance, long-term studies on how carriers can spread bacteria in communities also needed. We also need to evaluate prevention programs that are both effective and affordable for hospitals and individuals in those communities. Evidence-based prevention programs already exist. In hospitals, this includes screening patients on admission, using ointments and antiseptic baths to decolonize, and maintain strict infection control practices. In the community, education campaigns stress handwriting and avoiding shared personal items. The CDC has ran has run programs that cut MRSA bloodstream infections by 17% in just 5 years. Looking ahead, researchers suggest new things like genetic screening to identify carriers most at risk. These interventions show that prevention works when applied consistently. These are the references that support my research, including CDC, WHO, WHO, and severe peer review studies published in the last 5 years. Thank you for your time and attention.